Welcome to the Deep Dive. Today, we're taking a fascinating look at navigating the world of health and illness. Well, using the English language, we've got a really interesting collection of sources for you. Everything from materials for English language learners, blog posts, YouTube explainers, even other podcast transcripts.
Yeah, all focus on health in English.
Exactly. And our mission today, basically to give you a solid, easy-to-digest understanding of the essential words and phrases you'll need.
If we're talking about your health, understanding what doctors say.
And handling those unexpected emergency situations, too. Okay, let's unpack this.
Absolutely. Because think about it being able to clearly communicate how you're feeling.
Yeah.
Or, understand what a doctor's telling you in English.
Mm-hmm.
It isn't just about knowing the vocabulary.
Right.
It's about confidence and even your well-being, really. Whether you're traveling, living abroad, or just want to be prepared.
It's key information. Totally agree. So let's dive right into something we all experience, not feeling our best. The good starting point is simply saying, I'm not feeling well. But there's a whole spectrum of ways to say that, right?
Oh, there is. You could also say, I feel sick, or I feel ill. Maybe I feel unwell.
Is there a difference between ill and sick?
Well, ill tends to be a bit more formal, maybe slightly more serious sometimes than sick.
Okay.
Then you have more casual options like feeling rough or rubbish.
Rubbish, yeah. I hear that a lot in British English.
Exactly. Or off, out of sorts.
Yeah.
Saying you feel a bit rubbish is pretty common if you're just slightly under the weather.
It shows how, the same basic idea can be expressed differently depending on who you're talking to.
Absolutely. Context is everything.
Right. It's that nuance. Now, what if you're not feeling terrible, just not quite yourself?
Ah, yeah. In that case, you might say, I'm not feeling great, or maybe I'm not feeling 100%.
Those are really common.
Very common. They express you're below par without sounding, overly dramatic.
Makes sense.
And then there's the classic idiom, feeling under the weather. It's really widespread and usually implies something mild. It kind of softens it, doesn't it?
Yeah, it does. Under the weather, like you're acknowledging something's off, but it's probably not serious. Okay, now what about when you get that feeling like something's brewing, an illness is just starting?
Right, that creeping feeling. That's when you might say, I think I'm coming down with something.
Okay.
It signals those very early stages. You might even guess what it is. Like, I think I'm coming down with a cold.
Or the flu.
Yeah.
Yeah.
Which raises a practical point.
Yeah.
Once you know you're not feeling right, how do you actually describe those specific sensations?
Good question. Let's start with pain. That's often the first sign, isn't it?
Often, yeah.
The most direct way is just, my body part hurts. Like my head hurts.
Simple and clear. Or you could use ache as a noun, like backache. Or say, I have a pain in my body part.
I have a pain in my shoulder. Got it.
And for when it's really bad.
Oh, like my head is killing me.
Exactly. That phrase, killing me, really emphasizes intense pain.
Yeah.
Like a really bad headache. Now, it's useful to distinguish between ache and pain.
How so?
Generally, an ache is more of a continuous, often dull discomfort. Might cover a larger area, think muscle ache.
Okay.
Whereas pain tends to be sharper, more localized, maybe more intense. You might have a general stomach ache, but a sharp pain in your side.
Ah, okay. That's a helpful distinction. Right. Moving on. Something very common, nasal issues.
Absolutely. If
Yeah.
your nose is producing stuff,
Yeah.
you'd say, I have a runny nose.
Right.
If you can't breathe through it easily, then I have a stuffy nose.
And there are other ways to say stuffy, aren't there?
There are, like blocked nose, clogged up nose, and as you mentioned in British English, you might hear bunged up nose.
Bunged up. Yeah.
And of course, the simple act, sneeze.
Bless you.
Yeah.
So what about when it hits your throat?
The common phrase is, I have a sore throat,
Sore throat. Okay.
which often makes it difficult or painful to swallow. That word sore just describes that irritation, that scratchy feeling.
And then there's the sound, the cough.
Yes, I have a cough. And when you describe it, it helps to say how often.
Like, is it constant or just now and then?
Exactly. And how bad it is. The little tickle or a really deep, violent cough.
Mm-hmm.
You also hear about a dry cough, no mucus, versus a productive cough where you cough stuff up. Phlegm.
Right. Those are important details for a doctor.
Definitely. Now, what about feeling hot or cold? Your internal thermostat being off.
Yeah.
If you feel hot, flushed, you might say, I have a fever or a high temperature.
Okay.
You might also get chills, that feeling of being cold and shivering, even if you actually have a fever.
Weird sensation, that one. And then there's energy levels. or lack thereof.
Exactly. I feel tired is the basic one.
Sure.
For more extreme, ongoing tiredness, you could use fatigued. Or simply weak if your muscles feel like they have no power.
Mm.
And if you feel unsteady on your feet,
Dizzy.
yeah, I feel lightheaded, dizzy, or even faint, like you might pass out.
Not pleasant.
Definitely not. Okay, another area.
Yep.
Stomach issues. So many ways things can go wrong there.
Tell me about it.
I have a stomach ache.
Yeah.
Is the general term for pain in your tummy area.
Right.
If you feel like you might be sick, that's, I feel nauseous.
Nauseous. Okay.
If you actually are being sick and can't keep food or liquids down, you'd say, I can't keep anything down.
Yeah.
And the act itself, you can say throw up, vomit, or the more informal, be sick.
Got it.
And for the other end, intestinal issues. There's diarrhea, or spelled with an H in American English, diarrhea.
Right. Sometimes, though, it's not one specific thing, is it? Just a general feeling of being unwell. I think one source mentioned feeling fragile.
That's right. Fragile can describe that general feeling of being weak, delicate, not very strong, especially when you're recovering.
Makes sense.
And remember that YouTube video? It used splitting for a really bad headache.
Ah, yes, I have a splitting headache.
Really gets across how severe it is. So you see, there's a huge range of words to describe exactly how you're feeling.
Definitely. But what happens when you need to tell all this to a doctor or nurse?
Well, first step is usually making contact. You might say, I'd like to book an appointment, or schedule an appointment,
And you call the doctor's office in the U.S.?
or the surgery in the UK. Small difference, but good to know.
Yeah.
And when you first speak to the receptionist, maybe they ask something general like, what seems to be the problem?
How would you answer that typically?
A common way to start is, I've been having, and then list your main symptoms. I've been having headaches.
Okay, and that usually leads to more questions from the doctor.
Exactly. The doctor might start broad. What brings you in today? Or how long have you been feeling like this?
Checking the timeline.
Yeah. Or history. Is this the first time you've had a problem like this? Then they get more specific. Do you have a fever, a cough, sore throat, any respiratory symptoms? And they'll want to know intensity. How severe is the pain?
It seems like the duration, how long it's been going on, is really key.
It really is. And the grammar you use can reflect that. For ongoing things, present perfect continuous is common. I've been having really bad headaches for the past few weeks.
Oh, okay, I've been having.
But if it's a more stable symptom, present simple works fine. I have a swelling in my right knee.
Subtle difference, but useful. Okay, so you've explained your symptoms. What's next in the visit?
Often, a physical examination.
Right.
The doctor might say things like, I need to check your pulse and blood pressure.
Standard stuff.
Or, I'm going to listen to your heartbeat and breathing using this stethoscope. They might also check your lymph nodes, often gently feeling your neck, to see if they're swollen.
Okay, and after the physical check?
They'll likely ask about your medical history. Things like, do you have any allergies?
Crucial.
Absolutely vital. And are you taking any medications currently?
Right, to avoid interactions.
Exactly.
Yeah.
And hopefully, after gathering all that info,
You get a diagnosis.
yes, you might hear, the doctor diagnosed me with the flu, for example. Diagnosis is the name for identifying the illness. It often comes after they review any test results.
Okay, makes sense. So the doctor knows what's wrong. Now we get to medicine and treatment.
Right. If medication is needed, the doctor gives you a prescription.
And that word prescription means two things, doesn't it?
It does. It's the doctor's written order, and it's the actual medicine you get from the pharmacy. The verb is to prescribe.
Okay. And where do you take this prescription?
You take it to a pharmacy that's common in the U.S.
Or a chemist's in the UK,
Exactly. The person there is the pharmacist. They will fill your prescription.
meaning prepare the medicine.
Yes. Or you might just pick up your prescription if it's already ready.
And then comes the really important part, understanding the instructions.
Absolutely critical. The pharmacist or doctor will give you instructions like take 1 pill twice a day.
That amount is the dosage, right?
Yeah. Yes, dosage is the amount per time. Instructions might also say when to take it with food or on an empty stomach and things to avoid. Maybe alcohol or cold drinks or sometimes anti-inflammatories if they interfere. You've got to follow those instructions carefully.
Definitely. What are some common types of medicine people get?
Well, you have painkillers like paracetamol or ibuprofen, antibiotics for bacterial infections, Antihistamines for allergies.
Okay.
Medicine comes in different forms too. Syrup, often for coughs, an injection with a needle, or stuff you can buy over the counter without a prescription.
And treatment isn't always just pills, is it? There's often general advice, too.
Oh, absolutely. Doctors often advise things like get enough sleep, stay hydrated, drink plenty of fluids.
Avoid stress. Easier said than done.
Isn't it just? Also, rest for a few days and the classic drink plenty of water.
Yeah.
Simple things, but they really help recovery.
Good advice. What if the medicine itself causes problems?
Those are called side effects.
Like feeling sleepy.
Exactly. Drowsiness is a common side effect for some medicines. It's important to know about potential side effects and talk to your doctor if you're concerned.
Right. And ultimately, the whole point is to get better. What if some phrases for that? For recovery.
Well, someone might say to you, you'll feel better soon, or just get well soon.
Nice things to hear.
Yeah. And a good reply is often thanks, I hope so. Doctors might stress, follow the doctor's instructions. As you improve, you might say you're on the mend.
On the mend. I like that.
Or I've got over it when you're past the worst. When you're fully recovered, you're back on your feet.
And maybe you get a clean bill of health from the doctor.
Hopefully. Other useful verbs are recover from, treat, cure, get well, and get better. Lots of positive words there.
Wonderful. So we've covered feeling ill, getting treatment. Now let's shift to something we hope you never need, but it's vital to know. Emergency situations.
Absolutely crucial. In an emergency, quick, clear communication is everything. Phrases like call an ambulance.
Yeah.
Or call the authorities. And you'd specify who. Police, fire brigade, doctor.
And describing what's happening, how do you do that quickly?
You might shout, he's having trouble breathing. Or she fainted, meaning lost consciousness.
Okay.
Or there's been an accident. If it's a crime, there has been a theft or robbery or burglary.
What if someone's hurt?
I'm hurt or injured. Or more specifically, I have hurt my arm, leg, whatever it is. And if there's immediate danger, a loud look out or watch out.
Life-saving, potentially. What about asking for help from bystanders?
You could ask urgently, does anybody know CPR? If someone's collapsed.
CPR, right.
Or to find help. Where's the nearest hospital? And if you've lost something vital, like your phone or wallet, I have lost my phone, or I can't find my keys.
Okay. And some key vocabulary for emergencies.
You'll hear emergency room or ER in the U.S.
An A&E, accident, and emergency in the U.K.
Exactly. Same place, different name. A paramedic is the trained professional who arrives in the ambulance. Okay. CPR is cardiopulmonary resuscitation, chest compressions, rescue breaths.
Right.
Someone might be unconscious. There might be bleeding. Common injuries are a broken bone, a sprain, that's ligaments, a strain, muscles, or tendons. A fracture, another word for a break, often maybe less severe, and a concussion, a brain injury from a knock to the head.
Got it. I also saw the phrase, in the meantime, mentioned. How does that fit in?
In the meantime. It's really useful, not just in emergencies. It means during the time between two events.
So like
call an ambulance, and in the meantime, try to stop the bleeding. It tells you what to do while waiting.
Okay, that makes sense. And there were two other terms, biohazard and contagious.
Right. Contagious means a disease can spread easily from person to person, like a cold or the flu.
Yeah.
A biohazard is, well, it's a biological substance or situation that's a threat to health. It's a serious term. You wouldn't usually use it for a common cold, but maybe for something highly infectious and dangerous in a lab setting, perhaps.
Okay, more specific context. Right, let's shift gears slightly. Healthcare systems. They vary so much, don't they?
They really do. A basic split is public health care funded by government, taxes.
Like the NHS in the UK.
Exactly. Versus private health care, where you pay directly or through insurance.
Okay.
In the UK system, your main doctor is your GP, general practitioner.
Your family doctor, basically.
Pretty much. They handle general care and are usually your first stop.
Yeah.
If you need specialist care, like a cardiologist.
Our doctor.
Yeah. Your GP gives you a referral.
Okay. What other terms might you come across related to hospitals and healthcare?
You might have a routine checkup, just to see how things are, even if you feel fine.
Good idea.
Hospitals have visiting hours, specific times for visitors. An outpatient gets treatment, but doesn't stay overnight.
Right.
Whereas an inpatient is admitted and stays in the hospital.
And when you leave.
You are discharged. And in some systems, like the UK, there might be a small prescription fee when you collect your medicine.
Got it. Okay, finally. After you've been ill, there's the recovery period.
Yes, getting back on your feet. As we said, you might still feel fragile for a while.
Takes time.
It does. You need to get your strength back, get back to normal. If you had a cut or surgery, the wound needs to heal.
Mm,
Often, during recovery, the best advice is just to take things one day at a time. Don't rush it.
good advice. Wow, this has been incredibly thorough. Just to quickly recap, what were the main areas?
We started with describing how you feel, general and wellness, specific symptoms like pain, coughs, fever.
Right, the whole range.
Then talking to doctors, booking appointments, describing symptoms over time, understanding their questions and exams,
Yeah, and the language of diagnosis. Then we covered medicine and treatment.
prescriptions, pharmacies, instructions, dosage, side effects, types of medicine, general health advice.
And those all important phrases for getting better.
Exactly. Then we moved into emergencies, calling for help, describing the situation, key vocabulary like CPR, ER, A&E.
Vital stuff. And finally, we touched on healthcare systems, GP, referral, inpatient, outpatient.
And the language of recovery, feeling fragile, getting strength back, healing.
Phew, that covers a lot.
It does. But hopefully this wide range of vocabulary gives you more confidence to communicate effectively in English about your health.
Definitely. So, as you go about your day, maybe think about this. What are some specific health situations you might encounter where clear English communication would be really important?
Good question to ponder.
Maybe it's explaining a food allergy at a restaurant, or understanding medicine instructions you buy abroad, or even just telling a friend you've sprained your ankle.
Thinking about those personal scenarios really shows the practical value, doesn't it?
It really does. Well, thanks for taking this deep dive into health-related English with us.